5 students who have been kept home while under observation after coming in contact with the first U.S. Ebola patient will soon return to school. The district has taken additional steps to address some of the psychosocial needs to calm any remaining fears.
One of the messages that we have for everyone is practice good hygiene.
Connie Rodriguez heads the district's Psychological and Social Services Department. She says everyone must continue to use common sense behaviors. Methods such as washing your hands, covering your mouth when coughing or sneezing, and staying home when you're sick helps prevent the spread of any virus. But she says in the case of the 5 students who will soon return to class,
if you have been nowhere near someone who is contagious and showing the symptoms, that is what makes you contagious. If you are showing those symptoms, you have nothing to worry about.
Dr. Angela Moameka, Vice President and Medical Director of Community Health at Children's Health System, helps monitor the quarantined students.
Students that we had here at DISD that had to leave school, so those 5 students that you're speaking of, were never sick, are currently not sick. They simply were contacts of a man who unfortunately has passed away from Ebola virus disease. So in terms of them exposing others, they cannot. They are not sick with Ebola virus disease.
In anticipation of the homebound students' return, counseling and psychological services were on hand to provide guidance lessons like these, and they went inside the classroom to help lead those discussions. Class by class, both teachers and students heard from various counselors. The lessons focused on maintaining good hygiene habits while also addressing the potential that the returning students would be bullied, something Rodriguez says the district has zero tolerance for.
All we're doing is just reminding them that bullying is not acceptable and it is not accepted.
Dr. Moameka believes the district is tackling a real critical need that helps push fears aside.
There should not be concern. I mean, this is an excellent point to really stress, is when these children are cleared by the Centers of Disease Control, they are not able to expose you to Ebola virus or to the disease. These are children who should be reintegrated fully into all activities in the schools. And it's very important that the school administrators and the teachers really continue to reinforce what they've reinforced from the beginning, which is that these children are not an exposure risk. They need to come back to school. They need to continue with their social integration into the schools where they've been.
Speaking with several teachers and staff at the schools, they say they are excited and happy to welcome the students back because when that happens, they say a sense of normalcy will return. For The Hub, I'm Robin Harris, Dallas ISD News.